Why do chemotherapy drugs cause Roman IV site irritation and pain? Imagine sitting in a clinic, receiving a treatment that's meant to fight cancer, but instead of feeling relief, you start to notice discomfort around your Roman IV site. This common experience with chemotherapy can be explained by how these powerful drugs interact with your blood vessels and tissues. Chemotherapy drugs are designed to target rapidly dividing cancer cells, but they can also affect normal cells, especially those lining your blood vessels and skin at the infusion site. This is why some people experience irritation and pain during treatment. Chemotherapy drugs fall into two main categories when it comes to their effect on veins: irritants and vesicants. Irritants are chemicals that cause inflammation of the vein, known as phlebitis. This inflammation usually doesn't last long and is limited to the area where the drug is infused. Symptoms include burning sensations, swelling, tenderness, redness, warmth, and discomfort along the vein. The irritation happens because the drug's chemical nature irritates the inner lining of the blood vessel, but it typically doesn't cause serious tissue damage. Vesicants are more potent and pose a higher risk. If they leak out of the vein into surrounding tissues, a complication called extravasation can occur. This can cause severe tissue injury, including blistering, swelling, redness, and even tissue death or necrosis. Vesicants are highly toxic to cells, so when they escape into the skin and soft tissues, they can cause chemical burns and damage nerves and muscles. The irritation and pain from chemotherapy drugs happen mainly because of three reasons. First, these drugs can damage the cells that line the blood vessels, leading to inflammation and discomfort. Second, if the drug leaks outside the vein, it directly contacts tissues like skin and muscle, causing irritation and inflammation. Third, the high concentration of the drug at the infusion site can be cytotoxic, meaning it harms nearby cells, leading to redness, swelling, and tenderness. Certain chemotherapy drugs are more likely to cause these reactions. For example, vinca alkaloids, taxanes, and 5-fluorouracil are known to be associated with Roman IV site irritation. Using small veins further away from the main blood flow increases the risk of irritation, while central venous access devices like portacaths help deliver the drugs into larger, more stable veins, reducing the chance of irritation. In the context of bladder cancer treatment, many chemotherapy regimens involve intravenous drugs that can cause these local reactions. Managing Roman IV site irritation is important to keep patients comfortable and to prevent complications that could delay treatment. Healthcare providers take steps to minimize these issues by choosing appropriate veins or central lines, monitoring the infusion site carefully, and educating patients to report any pain, swelling, or redness immediately. If extravasation occurs, prompt action is necessary to prevent severe tissue damage. In summary, chemotherapy drugs cause Roman IV site irritation and pain because their cytotoxic nature can inflame veins and damage tissues if they leak out of the vein. The severity depends on whether the drug is an irritant or vesicant, the site of infusion, and how carefully the administration is managed. Proper precautions and prompt responses are essential, especially in bladder cancer treatments, to ensure patient safety and comfort. Always consult your healthcare team for personalized advice and support during your treatment journey.